Honorable Meshoe, please go ahead.
Is connected. Thank you, Deputy Speaker. Lockdown has unfortunately, among other things, resulted in the loss of employment for many providers in the homes. And that unfortunately led to hunger that would also cause accusation. That would lead to accusations of the provider failing to provide and resulting with the frustration that these providers have because they cannot provide for their families. The unfortunate thing is for these providers to unleash their frustrations on members of their families. So my question to the minister is that besides advising the victims of domestic abuse to go and report cases of abuse, does the department offer any counseling to the affected families to try and minimize the misunderstandings that leads to this frustration? Because when a person has lost a job, that it's not only the provider who is at pain, but the family also that cannot have provision is also at pain. So I want to know whether there's any form of...
Honorable Meshoe, thank you very much. Your time has expired. Please, honorable members, don't explain your questions. It takes all your time. Ask the question. We hope the minister will be able to respond to you effectively. Honorable Minister.
Honorable Muruti Meshoe. It's an old adage that a man who feels inferior runs to punish women for whatever they haven't done. So please, let the men who could not provide think the only way he could do things is to beat, harm those who have done absolutely nothing wrong. Those who actually expect love and care from him, particularly at this time of the pandemic. The Department of Social Development has been tasked by the government to distribute food parcels, never mind the social, the SASA, but there was also the 350 rands that was to be provided or given out just for the time being to families that find themselves vulnerable. But I really feel and plead with you, the man of the cloth, that it should not come from you, Muruti, that men who do not know what to do with themselves must go venting their frustrations to their families.
Thank you, Minister. The third supplementary question will be put to you, Minister, by the Honorable Thring. Honorable Thring, by virtual platform.
Thank you, Honorable Speaker. Honorable Minister, the importance of the modeling and data system used for COVID-19 cannot be overemphasized. The ACDP welcomes the recent announcements by the President Ramaphosa, hopefully based on accurate modeling, to remove some of the restrictions imposed on the church. A call made by the ACDP President, Reverend Dr. Kenneth Meshoe, in a letter he wrote to the Presidency. In the same vein, we also salute the churches, NGOs, and other religious organizations for their sterling work to assist the poor and the vulnerable amongst us during these trying times. Now, can the Minister also give us some clarity as to what directives, health protocols, and hygiene protocols and restrictions will apply post the announcements of the President to ease the restrictions on worship in a carefully measured way? And with regards to comorbidities, will there now be increased comorbidity reporting with regards to data? Thank you, Honourable Minister.
Honourable Minister.
Thank you very much, Madam Speaker. Indeed, the issue of modeling, we're working closely the point we're making is that we need to understand the limits and the limitations that are in the models. We can't necessarily take everything as it stands. We need to keep a watch on it and see what the worst possible scenario that are being predicted, and also do everything we can to change that trajectory so that whatever is on the model needs not happen. We must also salute the religious leaders for the way they have embraced the decision by the cabinet to lock down the country, where they willingly were able to participate in a program to educate communities to refrain from large mass gatherings. That has actually assisted the country to avoid a huge explosion that would have happened in the early days of the infection. For that, we're really eternally grateful to the churches, to the mosque, and to all the synagogues and all the different faith groups, because this is one area that would have been very difficult for us, and it has really made a huge contribution in improving the slowing down on the infection. Now, there will obviously be a number of restrictions that we in our normal daily life have to put in place. In the first instance, we want to acknowledge the role of the various churches of coming forward to offer various constructive suggestions about how we can fight this disease. So we take the church and the faith-based community as partners in the fight against COVID-19, particularly to ensure social behavioral change, making sure everybody, when you leave your house, you put on a mask, and when you frequent hand washing, sanitizers, and also ensuring a distance and keeping to the limited number of people in a place of worship, so that at the end of the day, on a day-to-day basis, the culture of how we behave, we hope that the church and the faith-based organization will be in the forefront, talking to people about what we need to be able to limit the spread of the infection. So from that point of view, we will continue to work with the faith-based communities, and also in the area of relief, social relief, and areas of ensuring that when we utilize some of the facilities, if we need to expand facilities into some of the places of worship, that this is opened and is acceptable, that in the way the church and the religious practices are performed, there's always an understanding of the spread of the infection with frequent wiping of the tables on the pulpits and so on, so that whoever is in worship, in a place of worship, does not go home having contracted the infection. Thank you very much, Madam Speaker.
May I first start off by finding out whether Minister of Basic Education is ready?
Yes, Speaker, I am.
Please, ma'am, thank you very much for being ready. Can I then ask you to respond to the question which was put to you by the Honorable Meshoe?
No, thank you very much, Speaker, and also thank to members of Parliament. So indeed, Speaker, we will provide personal protective, let me open the camera. I'm sorry about that. So we will, Speaker, provide personal protective equipment to all learners and educators in public schools. And the other answers that the provision will be made on arrival of schools for teachers. Everybody will receive their protective clothes upon arrival, and the provincial education departments are the ones that are responsible for procuring these PPEs, and the cost can be obtained from all different provinces. What National did through the Department of Trade and Industry was to develop the specification and a proposed price for all the different specifications, so that you don't have a situation where everybody buys at different prices. And that's all that we did, but all the procurement took place in provinces. And so how much they spent will be known by provinces, not by us, ourselves at national level. Thank you very much, Speaker.
Thank you. The first supplementary goes to you, Muruti Meshoe.
Thank you, Speaker, and thank you, Honorable Minister. While we appreciate what the Minister has said, I want to know whether unions that have been complaining, such as SATU, that schools are not ready because they do not have the PPEs, are they not honest in saying that? when they say that the PPEs are not in the actual individual schools, but they are in district offices, and they don't believe that the offices will deliver those PPEs on time. So my question is, are they not honest in saying there are no PPEs in the schools? Have they not seen it, or what is the problem?
Thank you, sir. The Honorable the Minister.
No, Speaker, I want to actually honor of other individuals. I'm stating facts as reported from different provinces. We're saying the protective clothing or those PPEs for learners will be available in schools upon arrival. We're saying we first sent the first stock in the first wave when we had your senior managers, they arrived. This week, because they were expecting teachers, the teachers' PPEs are arriving. The learners' PPEs will arrive on time, because what we were avoiding, which is happening in different schools, there are breakages. If they know that there are valuable items in schools, there are always breakages. We already have many incidents of breakages in schools. Just this week, we even had deaths where people were killed trying to break into our schools. So the point about whether they're honest or dishonest, I don't want to get there. I can only give you the facts of what would have been reported to me by MECs, and I have no reason to doubt what they were telling me.
Thank you, Minister. The second supplementary is by the Honorable M.E. Sukas on the virtual platform.
Thank you, Speaker.
Yes, ma'am.
Thank you, Speaker. Honourable Minister, dealing with inequity in hospital services across the health platform, our poorer, crowded areas are going to be hardest hit and overwhelm their drainage hospitals. How will we ensure that a sick person or sick patient needing a bed will get a bed regardless of where they live? Is there a standard decision-making tool that all clinicians will use to decide which patients get what level of care, and how will those decisions need to change as resources get more stretched?
Thank you, ma'am. The Honorable the Minister.
Thank you very much, Madam Speaker. Let me indicate indeed that there are constraints in our health systems, but that the President has announced additional resources to assist us to augment the additional needs that we have decided upon. So every province is now increasing the numbers of beds, putting up field hospitals in stadiums, in exhibition centers, and also putting up old facilities that could have been derelict are being renovated, so additional beds are being made available. We have had additional human resources being employed. So in the Cape, Western Cape, they've employed over 800 nurses in the past two weeks, and Eastern Cape has done the same, almost just under 1,000 nurses, because we see the need. We have also made a call to say the doctors who are unemployed, who are registered with the medical and with the Medical Council or South African Health Professions Council should come forward so that we can increase our human resources. So we want to guarantee that everyone will receive care on the basis of need, not on the basis of means. And as we go along, we'll make sure that everyone follows the protocols. The Ministerial Advisory Committee, together with the specialist team and the clinical society of the department, are looking at all the protocols that will determine what treatment each person gets, not as to whether anybody will be judged on the basis of whether they can afford or not afford. It will not be possible to deny anyone any assistance just because they are poor. That will make sure it does not happen. Thank you very much.
Thank you, Minister.
The last supplementary question will be asked by the Honorable Swartz from the Chamber.
Thank you,
Honorable Swartz.
Thank you, House Chair. House Chair, the ACDP is concerned about allegations of corruption with COVID-19 expenditure. And in this regard, there has been issues surrounding the provision of water to communities. What steps is the Honourable Minister taking to eradicate any corruption in this tender? And secondly, will various departments of government be coordinating the purchase of water tanks, given that 306 million rand has been allocated to municipalities in the indirect regional bulk infrastructure grant to fund the rollout of water tanks to communities? One could save money if you were working together as different departments to ensure that the same amount of money is paid per tank. Thank you, House Chair.
Thank you, Honourable Swartz. Honourable Minister.
We equally concerned that after all these procurements which are happening at short notice because of the emergency, we don't end up with problems of procurements which have not been done properly. The reason also I was happy that we are working with the Department of Water and Sanitation is that provinces themselves were procuring. The Department of Water and Sanitation has been procuring tanks even for us before we even ordered or joined on their tender. But also the advantage of this process was to manage the cost so that we don't buy a water tank for 15,000, somebody buys it for 10,000. So the the price that we're receiving, it's a price that had been agreed across the government. And I can say it here, Chair, that different provinces have made very good arrangements with their municipalities so that we're not going to be tanking or we're not going to be getting water from or sending water from centrally from DBE. Most departments of education and their municipalities have the arrangements that they have of tanking or of delivering water to the communities will include the schools to make sure that you can save costs. If there's a tank going into an area to supply water from that area, it will also provide water for schools. So all those matters that the member has raised have been considered to make sure that we can manage the cost, we can ensure that there's no duplication, but we can make sure that there's uniformity. But more important, to make sure that by the time we finish the process, we don't come back with lots of difficulties about wrong procurement or corruption.
The third supplementary question will be asked by the Honourable Swartz.
Thank you, House Chair. House Chair, rising from your response, Honourable Minister, the Auditor General has revealed the shocking state of municipalities and the regression of financial reporting, with only 18 municipalities producing quality financial statements and performance reports, as well as complying with all key legislation. And whilst we're speaking about compliance, given that the National Treasury will be making more than 20 billion rand available to municipalities to assist them in responding to the COVID-19 crisis, what steps, Honourable Minister, will you take to ensure that procurement irregularities in COVID-19 expenditure does not take place in municipalities? And would the Honourable Minister support real-time auditing in emergency procurements, given the huge amount involved, 20 billion rand? Thank you, House Chair.
Thank you, Honourable Member. Honourable the Minister.
That question, actually, the member is smuggling a new question which is still coming. It's part of the questions that are being asked today. So I don't know whether I should answer it now or whether I'm still going to come to that question.
Ask Chair, may I ask the Minister to answer?
You can give him. Okay, Honourable Member. You can, Honourable Minister.
So basically,
Honourable Minister, are you still there?
Yes, I'm here, Chair.
I was saying you can take the opportunity to maybe shed light if you can.
Okay. I was saying that we are working with Treasury on this matter. because on the 20 billion, because we haven't got the 20 billion, but we are also worried that since the financial controls in the municipalities don't seem to be up to scratch, we are also worried. We are working with Treasury to see if we can we can put some checks and balances about how this money should be spent. But at the same time, we have met with the Auditor General, and the question that I said was asking whether we would be willing to work with the Auditor General to do on-time auditing. And of course, we would be willing to real-time auditing. We will be willing if the Auditor General can help us with real-time auditing, that would be great. So if he can, we will be willing to work with him and to talk to Salga and to the municipalities that there should be real-time auditing on those funds. Thank you.
Thank you very much, Honorable Minister.